In medical astrology, the sun functions as the fire of life, a biological engine governing the rhythm and strength of the human heart. This solar engine maintains a direct chemical relationship with magnesium, while also regulating the baseline synthesis of vitamin A and vitamin D. These nutrients serve as the fuel for our inherent physical vitality. But this energy does not always reach the physical body in a continuous, steady stream. Instead, it frequently fractures and aggressively scatters as it encounters invisible cosmic resistance within the body's own internal structure. These fractures are caused by a hard aspect, a sharp 90-degree angle where other major planets block or conflict with the sun at the moment of birth. Medical astrologers use these specific angles of planetary tension as diagnostic markers. They pinpoint exactly where the flow of vitality is interrupted, identifying our deepest physical vulnerabilities. Understanding which planet opposes your sun reveals the timeline of your physical breakdown. It dictates whether your body faces a slow, chronic decay or a sudden, unpredictable crisis. A Sun-Saturn hard aspect brings the body under the jurisdiction of Saturn, the planet ruling our most dense structural elements. It governs the skeleton, the bones and teeth, and even the skin. In this configuration, Saturn acts as a systemic restrictor. It slowly suffocates body's ability to utilize vitamin C and D, effectively capping the system's regenerative potential. This restriction has a measurable clinical cost. As shown here, vitamin D is essential to block the action of the enzyme needed to create cortisol. Without it, high levels of this stress hormone can narrow blood vessels and raise blood pressure. When Saturn blocks the synthesis of vitamin D, the body loses the ability to distribute its calcium supply. This mineral, also ruled by Saturn, begins to circulate without a destination. This triggers calcification. Because calcium cannot enter the bones, it hardens in the wrong places, turning a vital mineral into an obstruction. These rogue deposits form kidney stones, stiffen joints, and block the tubules of the endocrine system. Because this restriction is a slow process occurring over decades, it manifests as lifelong chronic conditions, most notably osteoporosis and severe arthritis. A Saturn hard aspect acts as a slow strangulation of the body's resources. Over time, it turns our own structural foundations into the instruments of our decay. A Sun-Uranus hard aspect operates with none of Saturn's predictability. Its energy is erratic and highly volatile. Uranus does not slowly degrade the system over time. Instead, it aggressively short-circuits the body's electrical and nervous systems under sudden, unexpected stress. This cosmic shock produces immediate physical reactions. Sudden emotional or physical pressure triggers spasms and involuntary constrictions throughout the body. When these spasms occur, the body's metabolic demand spikes. It instantaneously burns through its available reserves of vitamin A, vitamin D, and iodine, sending these levels plunging to the baseline. This creates a pattern of perplexing clinical outcomes. A patient's thyroid gland may function perfectly during a checkup, only to become wildly erratic the following week when a stress event drains their iodine reserves. Uranus transforms hidden planetary tension into acute medical crises, resulting in sporadic and highly frustrating systemic failures. The astrological natal chart serves as a dynamic map of the ongoing cosmic pressures an individual will navigate across their entire life. By isolating specific planetary tensions, we can identify unique physiological blind spots long before physical disease takes hold. This allows for highly targeted preventative strategies, managed calcium intake to thwart Saturn's calcification, or the strategic stockpiling of iodine and magnesium to weather the stress shocks of Uranus. While conventional medicine often waits to treat the resulting symptoms, this diagnostic approach attempts to preempt the environmental and cosmic triggers themselves. Interpreting the tension between the sun and the outer planets transforms medical astrology into an actionable, lifelong roadmap for physical survival.